iiP Lab. My name's Nick, and today what we're going to be talking about is thoracic spine, particularly ways to assess and self-treat. Thoracic spine is your primary rotator in your spine, as well as a primary extender in your spine. In general, roughly about 15% of your rotation is coming from your lumbar spine, majority of your gross rotation is coming from your thoracic spine. Due to chronically poor postures, it's kind of the way we've evolved as humans, we kind of live in these positions of excessive thoracic kyphosis. Your thoracic spine is more complicated than the average Joe would think. You have ribs connecting to each level. You actually have multiple connections between the ribs and each thoracic spine level. You also have heavy neurological system going through. So thoracic spine is a big contributor of cervical dysfunction as well as lumbar dysfunction. So if it's ignored, you're going to obviously miss some components to moving better and performing better. So what I want to go over today with is an overhead squat and a quadruped assessment technique, and go over some hopefully helpful treatments for each of those. So the overhead squat looks at many things. It looks at core strength, hip mobility, ankle mobility, thoracic mobility. What I really want to focus on today is the thoracic mobility. So some common dysfunctions is you're going to see just the inability to get into the overhead position, kind of going to that shoulder flexion versus end range flexion. You're going to notice that kyphosis of the thoracic spine, and as they go, what can happen is they can get into that pitch forward posture. They can actually maintain a pretty good posture, but they get into that forward arm position, or you might even notice a little bit of a deviation in their trunk if they have some sort of rib unilateral thoracic spine dysfunction. Quadruped rotation. The advantage here is we're looking at thoracic rotation and locking out the lumbar spine. So you're going to get into hands and knees position. Try to bring your butt to your heels if you can to really appreciate that lumbar flexion. Then you're going to get your elbows next to your knees. Here what you can do is you can do multiple hand positions. If you want to help use the scapula to initiate that control or help with the motor control, you can be here, try to rotate through your spine. And roughly I like to see people to get over halfway up. So if all the way up was square to the ceiling, you want to get halfway up or higher without getting into that side bend or leaning to that other leg. So you should have equal weight on each side, rotate, get over halfway. If you can't, what we're going to go over are some techniques to address that. So one technique to work on for both mobility of the thoracic spine, but as well as breathing and motor control, is a wall squat, but on your back. So you're going to unload the squat pattern of an overhead squat, try to facilitate that thoracic extension, but also work on breathing. Breathing alone can really decrease that tone and can lead to improved performance on the squat, as well as trying to work on actually getting the thoracic spine to move better. What we're going to use here is we're going to use a band to help approximate your hip joint. And what that's going to do is hopefully help get your hips centered in the squat position, create that base of support to make it easier to work through your thoracic spine. So what I do here with my clients is I get them on their back. I have their butt relatively close to the wall where they're almost at that parallel, if not a little deeper to that parallel position. I am grabbing the band. I'm going to put the band around one leg. I'm going to wrap it around my behind, and I'm going to bring it up over to the other leg. And again, here what I'm doing is almost like centrating my hip joints, or adding that approximation into my hip. I've got that deep squat position. What you'll notice people here is they're in that lumbar lordosis, or extension of their low back, so you want to facilitate that neutral spine posture. People will also be rounded in the shoulders, kind of asking for that scapular retraction to open the chest. And then from here, you can work on the overhead posture, work on the diaphragmatic breathing. Inhale through your nose, exhale through your mouth. Thinking about not only breathing up, but breathing out. You again can kind of work unilaterally, bilaterally, work on the breathing. Doing simply a minute of this posture and then retesting the overhead squat is a great retest. Way to work on the thoracic extension in more of a loaded position, actually more in the face down, getting approximation through the joints versus being on your back, is to actually replicate that quadruped position and then utilize a foam roll to kind of work on that thoracic extension. So what you're going to do is you're going to get onto your hands and knees. You're going to use the foam roll to help kind of facilitate that overhead posture. Get your butt towards your heels to work on getting that lumbar flexion so it's locked out. And then from here, what you're going to do is as you roll the foam roll towards you, do a little bit of a scapular retraction, down glide as you drop your chest towards the ground. So you're getting a thoracic extension with a scapular movement pattern. So you're getting motor control and mobility, doing 15 15, 20 reps here, trying not to move your lumbar spine, but all thoracic spine and scapula. Good. So after working on these mobilizations and motor control techniques, it's always important to test, retest, get back into the overhead squat pattern, see if they can maintain that upright trunk posture after doing some of the techniques. Those are great ways to assess and treat the thoracic spine. Remember, isolate the dysfunction, integrate the dysfunction into movement patterns, and then take it into performance.